Is are these tests harmful for the baby? And the second one is, what would happen if you know that the baby is going to be a Mongol? What can we do?
See, as far as the screening test is concerned, as I said, it's just a blood test that we are doing on the mother and ultrasound. Now, a lot of people have this notion in mind that, like X-ray and CT, even ultrasound might be harmful for their baby. But what we have to keep in mind when we are doing ultrasound, we are just using sound waves. Like I'm talking to you. The same sound waves are what we are using when we are scanning our patients. The only thing is the frequency at which we use it is much higher. So ultrasound is safer during pregnancy. It would not harm the patient. And we are only offering a screening test. That's a blood test and a scan. So it is not going to be harmful either to the mother or to the baby. As far as the confirmatory test is concerned, yes, there is a small risk of abortion and infection involved. And that is why we are selecting a particular group and offering only those people the confirmatory test.
Okay.
Now, once we know, after we've done the confirmatory test and we know that the baby is a Mongol, the parents have to take a decision whether they want to continue this pregnancy or whether they want to terminate this kind of pregnancy.
This would be in the second or third month of pregnancy.
No, once you've done a screening test in the third month, we have confirmatory tests available in the third month itself, and we have another confirmatory test that is available at the fourth month, that is after the 16 weeks.
Okay.
Now, what you can do at the third month is that inside the uterus, you have the baby. Around the baby, there is fluid, and then there's something called as placenta, from which the baby gets the blood supply and all the nutrients. So in the third month, if you're doing the confirmatory test, you can take a bit of the placenta, and then from this placenta, we can find out whether the baby is a Mongol or not. And if you're doing it at the 16th week, then what we do is we take some amount of fluid around the baby, put a needle inside the mother's abdomen, and we take the fluid around the baby and find out again whether the baby is having Downs or any other such kind of chromosomal abnormality. So these are the two options that you have. Both these tests have a small risk of abortion, have a small risk of infection, and so you prioritize according to the need whether you want to do it at the third month or at the fourth month. Either ways, you would get a result by fifth month. See, both the tests when you do, it takes around 1 month for us to get the result in our hand, to get the chromosomal report of the baby and know whether the baby is chromosomally normal or not. So till fifth month, if the baby is having a gross genetic abnormality like this, it is legally allowed for the parents to opt for termination if they want to. But again, as far as this option of termination is concerned, it is entirely the choice of the parents because it is their baby, and we should not forget that they are the best people to make the decision for their own child. Now, they're not wrong if they want to continue, they're not wrong if they don't want such kind of a baby. See, it's like your own personal options. There are people who've taken infertility treatment for years and years, and now finally they're pregnant, so they might be ready to accept anything that falls into their lap. But there are other couples, she's getting pregnant immediately after marriage. She's pregnant for the first time and she comes to know that the baby is having Downs. Probably she would not like to continue that pregnancy. So it's entirely their decision, and then both these tests help them in making a decision before the legal limit gets over. So like that, these confirmatory tests are very important because it helps them to take their decisions. If they want to continue, it gives them an opportunity so that they can take their own time and decide for the delivery of such kind of a baby in a hospital which can take care to the special needs of that baby. So like that, there are various advantages.
These we see these baby movements in the stomach. So is that a good sign or a bad sign? A lot of baby movements,
Movements is always a good sign, but usually the mothers will start deciphering the movements only after 18 to 20 weeks.
Right.
So if a woman is getting pregnant for the first time, she might take a little more time to decipher the movements because initially the movements would be very light. As the baby grows bigger, the movements become stronger and it becomes more easier for the mother to feel it. But definitely baby movements is always a good sign.
So doctor, we have these stories about people who get married within their own community, their own cousin circle. What is the risk there?
There is, I would not be able to tell you an exact number, but yes, when people do get married within their own community with their first cousins or second cousin, it has been found out that there are a lot of genetic abnormalities, in which cases the risk goes up. So it is always, I think, better to avoid getting married in the same community and avoid this risk.
Can you tell us more on the sleeping positions of the mother when she's pregnant, all her 9 months?
See, usually we tell our patients to prefer to sleep in the left lateral position, because what happens is, in that position when the mother sleeps, there is increased blood supply that the baby is able to get. On the other side, what happens is the structure of the blood vessels in her body is such that if she's sleeping in the right lateral position, the vessels would get compressed and it would not be able to supply the baby that in that good way. So the left lateral position is the best position a mother should sleep in her pregnancy. At least try to sleep for the maximum time she can in that position.
So how many scans during the 9 months of pregnancy should the mother actually take?
See, there is no exact number. As soon as a female is pregnant, I think she go to her doctor and the doctor would immediately ask her to get a scan done. See, that is an early pregnancy scan which would give us a lot of useful information. We would know whether this pregnancy is inside the uterus, whether it is outside the uterus, whether it's actually a healthy pregnancy or not. But apart from that, I think every woman should have at least 3 scans throughout her pregnancy. One is in the 3rd month, when we can do a screening test for her for Down syndrome. Not only that, now we have good ultrasound machines available. And by 3rd month, all the major parts, the hands, the legs of the babies are formed. So we can pick up a lot of major abnormalities at 3rd month. Then the 2nd scan should be at the 5th month, when the baby is big enough and we can look at the baby in detail and rule out a lot of anomalies. Now the 3rd and the 5th, we've been dealing about screening the baby, ruling out anomalies. After that, I think every female should have at least 1 scan during the later half of her pregnancy, say somewhere between the 7th or the 8th month, as per her obstetrician's advice, to see that the baby is growing at the same rate. So that is basically what we call as a growth scan, because we want to see that, okay, till now we know that the baby is structurally normal. Now the next thing that we want to be sure is now the baby is growing well. So by the time the baby comes out, it's nice and healthy. But there's no particular a number of scans you can fix it to, because it would eventually depend on how your pregnancy is progressing.
Doctor, a lot of ladies take a lot of contraceptive tablets and medication. Would that have an effect when she's conceiving a child?
You mean before she conceives?
Yes. In her past life, she has taken a lot of contraceptive tablets, medication, to avoid having a baby. Would that actually affect later on when she plans to have a baby?
See, it won't affect later on, but then if she's taken it in the month when she has become pregnant, there are certain studies that it can affect the genitalia of the baby to a certain extent, but then the risk is very low. So we decide according to the type of contraceptive that the female has, the medicine, the kind of medicine. See, there are 2 types, progesterones and estrogens. So what she's taken, according to that we take a decision, how safe it would be or how much it would damage, considering that she's got pregnant in the same month in which she was on a contraceptive pill. But most of the contraceptive pills are safer now.
Right, doctor. On that note, thank you very much for being on Health Plus.
Thank you.